Man, I used to have those same problems, you know. But since I got my whip Compagnon card, when I take my lady out, I even get something back, you know.
Get something back? But you're a lucky fella.
I take your mind out the gutter, man. What I mean is, with whip Compagnon, I get back 1% on every purchase I make. With this card, I can spend in guilders and use it throughout the Netherlands and TDs. Instead of paying 1% of the dollar credit card, man, I get 1% back on every purchase I make at the end of the year.
What? I gotta get myself a Compagnon card.
Man, but let's go.
Let me go. Man, now my lady's birthday gonna be a real celebration.
At least now with Whip Compagnon, I know you're gonna get something back.
The Whip Compagnon credit card with limits as low as 500 guilders. You don't have to walk with cash and it is accepted by practically all businesses. The Whip Compagnon is the first guilder credit card that can be afforded by anyone.
We're now in the children's ward, and as you can see, we are now going to be speaking to Dr. Ofrenga once again. Dr. Ofrenga, obviously you not only tend to patients that come into your clinic, but you also see children on the children's ward. How do you combine that?
You only have 24 hours a day, unfortunately. But the care of inpatients is an extremely important part of it, and especially of the newborn babies, because babies who really get sick, they are in a hurry, and they are in need of rapid action. Fortunately, the nursing staff is excellent here, so they can do a whole lot, but yeah, we work close together, so if any baby is called for, then I get a call and then I need to run and race, and in a few minutes we're here. In the daytime it's a little difficult to change a baby. At night it takes me about 5 to 7 minutes. And most babies are already then in trouble, and they need care in the sense of extra oxygen, IV fluids, medicines, what else. What happens pretty often in babies, and especially on this island, there are many babies with infection born with whatever kind of bacteria. And that has to do with all kinds of things. First of all, we all are not sterile. We carry around bacteria, which is normal for us adults, but may be harmful for babies. But also in pregnancy, if a mommy starts losing fluid, water bag break, yeah, then it's time to come to the hospital rapidly and don't wait home for another few days, because if you wait a few days, then the risk of having a very sick, infected baby is enormous. And that's something we try to prevent or treat in time, and usually with good success.
Do you see every baby that is born here in the hospital?
No. The newborn babies are in the Dutch-based system the responsibility of the one who is guiding the delivery, so the gynecologist or the midwife. But if any problem noticed, then in no time I get a call, and then I usually run over, or they come to my clinic, or we bring the babies in here.
But how often do you come to the children's ward within a day? Can you also be called out of your clinic to come and tend to a child here at the ward?
We start almost military-wise every morning 7:30 sharp to walk around and along all the admitted children in the hospital. And then indeed, in the meantime, doing the outpatient work, I get many phone calls, and sometimes I need to run, not only to the ward here, but also to operation room, delivery room, emergency room, wherever there is a problem at that moment. So I do get some exercise every day.
Looking for that prescription that the doctor just gave to you and you can't find it at no other pharmacy? Well, the Orange Grove Pharmacy is where you should be. The Orange Grove Pharmacy, we carry a wide range of American and European prescriptions and drugstore items. We also do personal care products. We offer friendly services and 24 hours emergency delivery. Charges may apply. We're open Monday to Friday, 8 a.m. to 6:30 p.m., Saturdays, 9 to 1 p.m. Orange Grove Pharmacy, supporting a healthy
Lasagna, a torture test for the best non-stick surface. The Scotch-Brite no-scratch multi-purpose sponge with its unique cellulose weave whisks grime away, leaving expensive cookware scratch-free and spotless. Scotch-Brite, smart, simple and clean.
What are the most common causes for children to be admitted here in the children's ward?
The older children, the not newborn babies, they usually come for fever, having trouble, respiration, asthma, sinus trouble. Kids who do get a seizure, a fit because of the high fever. Accidents happen. And unfortunately also kids sometimes do things which are not so wise. They drink something they find home which may be toxic or whatever. But the main thing we have in the hospital is asthma, respiratory problems. And of course the vomiting, the diarrhea, easy dehydration. So those are the common causes. Then of course a little less common are the very sick kids with severe sickle cell disease, for instance. Name it, many of those. And then we have a whole bunch actually of newborn babies who need special and extremely rapid care. And there may not be many every year, but it's very intensive treatment, and one baby may take 24 hours constantly, also from the pediatrician. So the nursing care is extremely intensive, but also from the doctor it may require quite some time, day and unfortunately night as well sometimes.
Okay. What is the estimated length of stay though for a child coming in with a respiratory problem? How long do they stay on average in the hospital?
I think our average stay for that type of problem is between 4 and 5 days. And I think that's about half compared to Europe, but we can work pretty fast. Many things can be done home. But if your child is not known with that and that problem, then first you need to treat properly, second you need to learn the parents how to deal with it. But most kids can stay home and treat at home. Of course our society is not so easy because many people work, and many people not only one job but more than one job. So many mummies and daddies don't have much time for a more than normal child. If a child is sick, it needs a lot of extra care. And that's difficult in this hard-working society on this island.
Okay. And the parents, are they allowed to stay overnight with their children in the hospital?
Parents, one of them is absolutely allowed to stay. We call it rooming in. And there are facilities, we have extra beds. Sometimes we get some extra space where mommy and child could be convenient, even in an airco place with some TV. Unfortunately, it's simply not feasible in this incubator ward because there is no space. So for the non-babies it is absolutely possible and welcomed, and for the newborn babies unfortunately it can't be. But then many mummies from newborn babies are still in the hospital.
Dr. Ofringa, we've talked about so many different topics pertaining to pediatrics, and we haven't talked about breastfeeding, which I know happens to be very important for a mother to do with her newborn baby. How does it how is a mother affected when her child is put in an incubator? Can she still continue to breastfeed, or would you advise her to stop? What would be your advice to parents or mothers concerning breastfeeding?
Now, let me start at the beginning. I think there is no better feeding for babies than human breastfeeding. That's quite simple. There is hardly any imaginable condition when you cannot breastfeed. Only a few medicines do not go along with breastfeeding, but even antibiotics can simply be taken by mummies and she can still breastfeed. There are many myths, no? The trouble is when we get a baby here, then the mummy is not so happy, and usually mummy is already in the hospital, has been operated, and then we disturb the normal process. We still try to encourage, and certainly our nurses have a lot of work in talking and encouraging, and sometimes helping mommy by pumping and whatever. But unfortunately, many of the babies who come in here are not in good condition. They cannot drink immediately. They need to wait a little till everything settles down. So indeed we disturb the normal process, but as soon as oral feedings are tolerated, we prefer to give breastfeeding if available, and if not, then we need to use one of the formulas on the market. But again, there is no better milk than breast milk, absolutely.
Dr. Ofrenga, thank you so much for the vital information you have given us today pertaining to pediatrics and also concerning that last little bit about breastfeeding and how important it is. We thank you so much. And to you, the viewing audience, we would also like to thank you for once again having tuned into A Better Place. Stay tuned to our next program.